Now, when you look at all of these people out here, and we have students, we have senior citizens, we have middle-aged people.
You're all pre-alcohol stuff, that's what we're all.
We have old-timers. What physically can you say to them about what they should know about themselves? Because what applies to Vera would not apply to Michael, or would not apply to Kevin, or any of these students. So we have to look at life and its physicality in terms of age groupings. How do you do that?
This time I'm going first.
Funny I should ask that, right?
I didn't know really what I would bring, but a picture's worth 1,000 words. I don't even know if you can get these anymore, but this is actually a real bone. This is from a skeleton. Now they're made of plastic. And it's chipped, which is actually quite nice because the top of the greater trochanter is knocked off. And I want you all to get a chance to look at the miracle. Whether you believe in God or not, this is a good place to actually say that we believe in God, but not most doctors don't, but I do. You will appreciate how incredible it is that you walk on something that some of you with osteoporosis, older women in the audience, tomorrow I do 15 surgeries a week. Tomorrow I'll be doing 6 of them, 2 hip replacements, 4 knee replacements. Some of those patients will be 85 or 90, some of them are 35. Some of them are so osteoporotic that when I take the cartilage off the top of their knee, I literally can take my little finger and push into the cancellous bone. Yet, it can support a 120-pound person. So the structure that you have is amazing. So I brought you to talk about variation. This is a typical person's hip, femoral head and neck. Look at the size of it. In the middle 90s, I had the good fortune of taking care of Wilt Chamberlain. I did his hip surgery. He was 7'1", and the prosthesis I would use is not on the shelf of small, medium, and large. I had the genius idea, and he was up for it, of taking a CAT scan, which is a 3-dimensional X-ray of Wilt's pelvis and hip, so that I can send it true size to Indiana to build a prosthesis. So it's called CAD-CAM, Computer Assisted Design, Computer Assisted Model, CAD-CAM. This is Wilt Chamberlain's hip. Look at this one, let's put this one up.
Whoa.
Look at the difference, okay? About 2 months ago, I had the good fortune of seeing an actor. He's in one of the movies you've seen, but he's this big. He's a dwarf. And can't walk anymore after years and years. And he came to me, literally 3 feet something. There's no size for his prosthesis. So he said, okay, I've been down this road before. I'm going to send you for a CAT scan. And I'm going to send him to Indiana where they have a CAD scan. And I'm going to have him build your hip so that I can create a prosthesis with all the twists and turns that will customize fit and be perfect for you. And this is his hip. So look at the difference. You talk about,
Whoa.
see this room. This is Wilt, and this is his. Appreciate the angle of the ball to the neck, to the shaft. Appreciate that his ball is sunken further down. And all the spurs and osteophytes, look at how banged up this is. Walking on this for his whole life, making a beautiful career in Hollywood. But now he can't walk anymore. Now I'm happy to tell you, you'll be seeing him again because now he has a hip that he hasn't had in years.